So to apply a TED hose to a resident, all I need is the TED hose or compression stocking, which are typically in their room. So I'm going to knock on the door and wash my hands. Hi Annie, I'm Myra. I'm here to put your TED hose on. All right. We're going to provide for privacy. And when I have the TED hose, if there's writing on the TED hose, it should be on the outside, or you should be able to read it correctly, so it shouldn't be backwards once it's on the resident. And then you also want to locate the heel marker. So you're going to put your hand in like you're going to put it on their leg and stretch, and then you can see the square that's going to go on the back of their heel. To put the TED hose on, you can either roll down the top, or you can gather, or you can turn the TED hose inside out. And so for any of those methods, I'm going to find the heel marker. If I turn inside out, I'm going to pinch that with my fingers and turn it inside out that way. I'm going to choose to gather the sides of the TED hose down to the heel. Okay, Annie, I'm just going to get your leg out here if that's okay. All right, so I'm going to make sure I know that the heel's on the back side, so I'm going to stretch that again and check that the heel's in the right place. I'm going to put that over her foot. I'm going to get it on just to where that heel marker is. And the reason I want to check there is once I get it up her leg, it will be very difficult to turn that or readjust. So now I see the square here. That's right around her heel. Okay. I'm going to try to get this as smooth as possible. Get all the wrinkles out. And bring that up the rest of her leg. So these are knee-high TED hose. They're also thigh-high TED hose. So you're going to want to check the heel marker that there's no wrinkles there. And then this needs to go all the way over her toes or all the way behind. We just don't want that band around her toes to cause any discomfort. Typically people that wear TEDs don't walk at all, so it shouldn't cause any discomfort in their shoes. Usually just wear slippers over their TED hose. Then we put TED hose on in the morning when the resident has been laying flat, and so the swelling in their legs, because it's at heart level, should be the lowest. And then we keep them on during the day because as they sit, that blood or those fluids tend to pool in their legs, and the compression gives a little squeeze to put that back into circulation and get back to their heart. So usually on in the morning, off in the evening. If you are the person that takes them off in the evening, you're just going to rinse them out with soap and water in the sink and then let them hang over a hanger to dry.